found the scans absolutely faultless. I, again, had hang-ups about these kinds of things from having them done years ago. I feel like the process has just evolved completely. I mean, the machinery's changed. It was just very, very easy and straightforward, and there was no uncomfort, upset or anything. It was just, there was no negatives to take away from it. It was just easy. I've just felt completely looked after, a very easy process. And like I said, I have no negatives whatsoever to take away from anything. There was some discomfort along the way, but none of that I can remember to this day. Nothing is standing out. I was saying to Andrew just before, I actually used to look forward to coming to my appointments just because of the evolution within each appointment. Across the whole process, it was obviously huge, but every time I came here, something new was taking place, a new procedure going on which would evolve my teeth to the next level. And it was actually really exciting because I'd leave here looking slightly better each time and getting closer and closer to my goal. So it became quite an exciting process with no negatives that I really remember. The healing process was fine. It lasted a couple of days. I took paracetamol and ibuprofen for the first 24 hours, and then I was able to stop because it wasn't that intense. I'd had root canal treatment on the NHS a few years prior, and I remember that taking weeks and weeks, and it was super sore and painful. So I guess I'm just comparing this to that because it was a similar kind of thing. But it was just incomparable. There was no similarities there. It was very quick. The procedure itself was done. I was in and out pretty quickly. Despite Andrew telling me not to, I actually went straight back to work on the same day and was able to carry out the rest of my shift in a pretty normal way. And then again the next day after that. So yeah, I guess I was straight back into normal life, and it didn't really alter that much for me, so it's good. It's improved my confidence a million times over. Knowing what I know now, having the faith that I do in this dental practice, I would have definitely got it done sooner. I do think that from a young age, you're kind of poorly educated on dentistry and looking after your teeth. And I just don't think it's a major concern to you when you're younger because of how we're brought up and how we're educated on it. I'd like to sit here and say, yeah, I would have got it done a lot sooner, but I also think that it was kind of part of growing up, which allowed me to get it done. I'd left it a little bit too late, and yeah, given the time, I would have definitely got it done sooner.